Okay, friends, I'm here with Dr. Nelson today, and we are talking about PCOS. I'll let you take over, Doctor.
Okay, well, every week I have a new PCOS patient. So PCOS stands for Polycystic Ovarian Syndrome. And you probably heard of that before, but really it's most women with PCOS don't actually have multiple cysts on their ovaries, but they can get those, and we can talk about why. But PCOS is a combination of a few of these things here. Weight gain, unexplained weight gain. You just don't know why, you just keep going bigger and bigger and bigger no matter what diet and exercise you follow. Irregular periods. You never know when you're going to have your period, which makes it very hard to get pregnant. And then hirsutism and acne. Everybody knows what acne is, but hirsutism is dark hairs basically where you don't want them. So getting male pattern hair growth on your chin, chest, belly, those dark hairs that you don't like. And then also thinning hair. That's thinning hair in your head. Not this bad, but any for a woman is not good.
So if we're having like one of these symptoms, do we need to come in, or just a few of them would indicate it?
That's a good question. Yeah, you can actually have a woman with PCOS who's skinny but just has irregular periods. Or you can have a woman with PCOS who's got weight gain, hirsutism, and acne, but having regular periods. And so, yeah, it can present with just one, but if you're gonna, full on PCOS, everything in the book is you're gonna have all these.
Okay.
But let's talk about why they happen.
Right.
And this right here, insulin resistance, is the cause of it all. It's not actually cysts on your ovaries that's the cause. It's insulin resistance. So what that means is it's a pre-diabetes kind of thing. Insulin's job is to get sugar from your blood into your cells so your cells can use it for energy. But if you're insulin resistant, you're having to make a ton of insulin all day long, 24 hours a day, to try and take care of your blood sugar. So you're cranking out a bunch of insulin all the time. And insulin's job is to store energy, and it's incredibly good at storing fat. So that is why you get the weight gain. Now, a lot of patients will go to their doctors and they'll say, well, I checked my blood sugar and I'm not insulin resistant, I'm not diabetic. And then they come to me and I say, yes, you are. Let me check your fasting insulin and show you that it's elevated. And let me check something called leptin and show you that you're in fat storage diabetic mode. And I always see them there. So insulin resistance causes the weight gain. The insulin resistance also affects the pituitary gland talking to your ovaries. And that messes up your periods so that you no longer ovulate every month, and you're not getting that nice bump of progesterone for 2 weeks every month. And you're not getting
That's why they can't get pregnant.
Right. Well, they're not ovulating, yes. And so they don't get the progesterone and they don't get the estrogen going up every month, which then results in no period. All right. And so you get these, you never know when you're going to have your period, and they can't get pregnant. The progesterone losing that progesterone is a big deal too, because it's not only important for pregnancy, but it's what reverses osteoporosis, breast cancer, and Alzheimer's. So women with PCOS are much higher risk for those things. The hirsutism and the acne and the thinning hair, this is because of how the insulin resistance affects the adrenal glands, and they start to produce a lot more DHEA, which has a male hormone action to it. But men and women both have testosterone and DHEA. It's just that women with PCOS get way too much DHEA and sometimes too much testosterone. But those things cause the dark hairs where you don't want them, the acne, and the thinning hair. Okay? So let's talk about how you treat PCOS. Remember, the biggest issue is insulin resistance. So you got to have a good diet. You got to cut out the sugars. You got to look through your whole diet for where you're getting sugars. Obviously, it can come in sodas, even if you just drink juice all day long. But you want to just drink water. Get the sugars out of your diet.
Even natural sugars.
Even natural sugars are going to cause this. And Diet Coke is not better than regular Coke. The diet stuff will do the same thing to you. Okay? Even look in your, are you getting high sugar cereals, or you got peanut butter with sugar in it versus just peanuts? So look around in your diet for places you can eliminate sugars. The medications I use to treat PCOS, Metformin is the first one. Metformin is a first-line drug for diabetes. because it's what addresses the true issue, the insulin resistance. It helps your insulin receptors work better so your body doesn't have to make as much insulin 24 hours a day, so you stop packing away the fat, okay? And stop affecting the brain talking to the ovaries, and stop affecting the adrenal glands in a bad way. So metformin, twice a day. We try to get up to full dose on that. The side effects of metformin can be upset stomach, but usually that goes away within a week and you're fine. Progesterone, I always give women progesterone. And the reason is because they're not getting that monthly big bump of progesterone for 2 whole weeks out of every month, because they're not ovulating, having regular periods. And remember, progesterone deficiency leads to breast cancer, Alzheimer's, osteoporosis, poor sleep, anxiety, poor hair, skin, nails. So I supplement their natural progesterone, not birth control kind of progesterone, but the natural kind, so that you get in that protection. And once your body starts to have regular periods again, because you're controlling your insulin resistance, then we might be able to come off the progesterone if you're making your own every month. I always optimize your thyroid. Everybody's thyroid takes a downward turn after age 30, 35. And sometimes pregnancies cause your thyroid to just bump down like that and stay at that lower level as you age. Thyroid's job is metabolic rate, fat burning, mood, enjoyment of life, immune system. So if I can get you from the bottom end of normal thyroid up to the top end of normal thyroid, all of this will get better faster.
Right.
Okay. And the other thing is spironolactone. Spironolactone is a medication that's been used for, it was actually first developed as a blood pressure med, but they found that women who took it had less hirsutism and acne. What it does is it blocks the DHEA and the testosterone at the skin level to get rid of these unwanted side effects.
Is that one, the spironolactone, like if the metformin, progesterone, and the thyroid are all kicking in, wouldn't the hirsutism and acne kind of start to fade away on its own anyway?
It will, but it can take months.
So, okay, gotcha.
Yeah. The more you do your own really strict no sugar diet and good exercise, the faster it'll kick in, and
the faster everything else will work.
Yeah, but spironolactone, I mean, it might be 9 to 12 months before you really get control of everything, and we can use this in the interim to help control these things.
Which are big things to women.
Yeah, those are big deals.
For sure.
Right. So
when a woman comes to you and like, what kind of labs do you say, oh, well, you're having these clinical symptoms, but what kind of labs will also help figure that out? Just the insulin?
Good question. I check the female labs, the female hormones. I check the thyroid levels to make sure you're at the top of normal. If you're not, we get you there. But what helps me diagnose this is a couple things. Number one, the brain signals to the ovaries, the FSH and the LH. FSH is usually higher than LH, but PCOS women have a flipped ratio all the time, not just when they ovulate. So I see, every time I check their labs, a flipped ratio of FSH and LH. But also what I do is I look for insulin resistance, okay? And the way I look for that is not just hemoglobin A1C, which you've heard of. You might just hear it as A1C. This is your 3-month average blood sugar. Sometimes these women actually have a normal average blood sugar, but they're still pre-diabetic and insulin resistant. So I check their fasting insulin. Insulin is supposed to go up when you eat and stay up for a couple hours to take care of the food you just ate and get it into your cells. And then it's supposed to go back down to normal. So what I show these women is I say, let's get a fasting insulin on you, 4 or 5 hours fasting, it should be normal. And what we find, it's way up there. So that means that 24 hours a day, they're packing away fat, okay? And then I also check leptin. Leptin is not the cause of the insulin resistance, but it's a really good gauge of what's going on in your body. You can have a normal hemoglobin A1C, but you can have really high insulin, and you also have a high leptin. Leptin is becoming known as the fat storage diabetic hormone. Levels above 15 to 20, you're in fat storage, insulin resistant diabetic mode. Levels below 15, your body is in fat burning, non-diabetic mode. I almost always see elevated levels, which go right along with the elevated insulin, which is but they have a normal A1C because they're working so hard to keep this normal. So oftentimes a doctor will just check this and say, well, you're normal. But below the surface, you see that they are insulin resistant or pre-diabetic, which brings us into why
finding the
this whole
root
thing is
cause.
happening.
Gotcha.
Yep.
All right. Thanks so much, Dr. Nelson. I think that this has been super informative. And I know that so many of my friends have PCOS, and I didn't understand like the reason behind it. I truly only thought it was like an ovarian issue. So thanks so much for taking the time.
You're welcome.